Hi everyone, we're here at the New Bedford Department of Health on Purchase Street to talk about flu shots. This is something that we promote every year so that, for the obvious reason, so that people don't get the flu. And it works, I can attest to it. It's a vaccine that is rolled out every year, it's tried and true, and it's current. But this year things are obviously different. It is especially important during the pandemic that people get their flu shots. Now why is that? The most important reason, the biggest reason, is that for people who may have flu-like symptoms, which could be the flu, which could be COVID, so coughing, sneezing, head congestion, all those things, they might go to the hospital thinking they have COVID when in fact they have the flu, and that puts greater strain on St. Luke's Hospital and any of the hospitals that folks go to in the New Bedford area. And we want to avoid that. We want to make sure that as winter arrives that our hospitals, our healthcare system has as much capacity as possible to deal with anything that comes up concerning COVID-19. The other reason, relatedly, is that if children come down with symptoms, it might lead to their being absent from school and having, even if they are in the classroom, they will have to go remote entirely under the rules that are in place in the school district. So again, we want to, at least for 14 days. So we want to avoid that as well. We want to keep kids in school. So the way to do it, the way to ensure that we don't respond to COVID when it's really the flu is to get a flu shot. That's going to help out a lot. Okay, so I'm about to get my shot. I'm going to put my mask back on, but I'm going to turn to Julie from the health department who's going to administer the shot to tell us a little bit about what it entails, and then we'll go ahead and do it. So Julie, tell me what I can expect. And tell me if I'm going to cry.
No, you're not going to cry. The flu vaccine is a very simple vaccine, and it's going to protect you from the flu. It's very simple. We go into the upper arm, a small injection, a tiny little pinch. You're hardly going to feel it, and then that's it. Takes a few seconds, and then a couple of days later, you might have a little bit of soreness, and that is it.
A tiny pinch.
A tiny
That's
pinch.
It. I bet
Very
you say
quick.
that. I bet you say that to all your patients.
I do, and it is all the time.
Okay, I'm bracing myself.
Okay.
All right.
We just got to raise this up a little bit.
All right, don't wrinkle my Hawaiian shirt.
I'll try my hardest.
Oh, that was nothing.
I told you.
Just a plain Band-Aid, no SpongeBob?
No, we don't have SpongeBob right now. Slim pickings out there.
All right. So anyway, I encourage everybody to get their flu shot this season. It will make a difference. Again, as with everything else with COVID, doing the little things, the mask wearing, the social distancing, and now flu shots will help us all manage this big challenge that we've been able to manage pretty well so far. So get your flu shot. They're free, and you can get them in lots of places, and we'll list all those places on the city website, but one of those places is right here at the New Bedford Department of Health.
Now it's time for our director of the health department to get his flu shot.
So Julie, while I'm getting my flu shot here, maybe this is a good time to ask a few questions.
Sure.
How would a person make an appointment for a flu shot?
Well, first they have to call the New Bedford Health Department at 508-991-6199. Ask for the nursing division. You'll speak to either Julie or Michelle. We're the public health nurses, and we will make an appointment for you to come in and see us for a flu shot. There you go.
Well, thanks. Thank you, Julie. And so what should a person expect when they come to get a flu shot here at the health department?
Well, the day of their appointment, they need to show up with a mask on, We cannot allow you in without a mask. If you are feeling any COVID-related symptoms at all, fevers, body aches, anything respiratory, please call and reschedule and do not come to the office that day. And expect a temperature check and some COVID screening guideline questionnaire that you have to answer before the vaccine. And if you have insurance, please bring your insurance card with you on the day of your appointment.
And lastly, who should be coming to get their flu shot?
Everybody, especially this year is the most important, so we do recommend that everyone come for their flu shot.